What will the vitamin D levels be in hypoparathyroidism? They'll be decreased. Patients with HIV, should they get the pneumococcal vaccine? Yes. What sort of TB medication is associated with liver toxicity? Starts with an I, isoniazid. Note, hypophosphatemia can occur in alcoholics. And a key thing to be, if you're a physician, is to be beneficent for the benefit of your patient. Is diabetes a contraindication to surgical treatment for the most part? No, it is not. Should acute cystitis be treated in a young patient? Yes. Yes, it should. What's the equation for sensitivity? True positives over the total number of tested positive. And the equation for sensitivity, by the way, is the true negatives that tested negative, all that divided by all the people that were tested negative. And of sensitivity and specificity, which one helps rule out a condition? Sensitivity, right? Is it fine to give opioids to a sickle cell patient that's having a vaso-occlusive crisis? Yes. Yes, it is. What common condition happens after a motor vehicle accident when someone's chest hits the steering wheel? Flail chest. Obviously, you know the tetanus prophylaxis. Basically, you don't give the immunoglobulin unless it's a dirty wound in a patient that's never had the vaccine. Are herbal medications regulated? No, they are not. What is the side effect in males if they have radiation therapy in the abdominal or pelvic region? Radiation proctitis. If your patient is having severe headaches with nausea and vomiting, what imaging should you get for them? A head CT. How can you treat opioid withdrawal? With methadone, buprenorphine, or clonidine. Use one of those for the most part. For atopic dermatitis, is it smart to maintain skin hydration? Yes. For atopic dermatitis, maintain skin hydration. And what medication is used basically to treat atopic dermatitis? Topical triamcinolone. A patient with ethylene glycol poisoning will have what sort of breathing? Rapid, shallow breathing. How do you treat ethylene glycol poisoning? The fomepizole infusion. A patient with a hepatic hydrothorax should have spironolactone, furosemide, and restrict sodium. Is that true or false? That's true. What is the most common cause of secondary amenorrhea? Pregnancy. Pregnancy is the most common cause of secondary amenorrhea. Note, keep this in mind, keep this in your mental Rolodex. Mitral valve insufficiency, secondary to intrinsic defect of the mitral valve apparatus, is a chronic primary mitral valve regurgitation, okay? What medication that starts with an A is used to treat worms? For the most part, albendazole. When you're discussing smoking cessation in the patient, what's a good way to start the conversation? You could start the conversation by saying, let's talk about smoking. What sort of crisis will a patient with CREST syndrome likely experience? Sclerodermal renal crisis. And how do you treat sclerodermal renal crisis? With captopril and IV nitroprusside. Treats sclerodermal renal crisis with captopril and IV nitroprusside. Combined radiation therapy and chemo is a treatment for head, neck, and throat, or those ENT sort of cancers, by the way. They often get radiation therapy and chemo. A patient with bitemporal hemianopsia should get a MRI of their head if there's concern for Nelson syndrome. Cushing's disease and pituitary enlargement, by the way, are associated with what syndrome? You should definitely know this. Nelson syndrome, right? What sort of plot-like things or characters are associated with rabies? Caves, bats, rabid dogs, skunks, and foxes, right? And do people generally do well if they have rabies? No, they do not. It's a horrible, horrible, horrible prognosis. People die from rabies. It's so bad. If a patient had stroke and they're in the hospital, what's one of the first studies that you need to do? You need to do a bedside swallow because you can't have them in there ordering things from the cafeteria. Next thing you know, you're hearing all these alarms because they're choking on something. Stroke often affects your throat coordination, right? So you don't want that. By the way, you treat a stroke patient with low-dose heparin. Does smoking cessation decrease the risk of aneurysms? Yeah, stop smoking. Is causation definitely associated with outcome? Well, all right, that's weird. Let me just read this. Causation is not definite just because an association exists, right? I'll say that again. Causation is not definite just because an association exists. A patient with ST depression with exercise stress tests needs what intervention? A PCI, right? And what sort of let me say if I can not give this away. A patient with hereditary hemochromatosis, why do they need to come to the hospital at regular intervals? For therapeutic phlebotomies, right? They need the therapeutic phlebotomy. If your patient has a B12, uh, hmm, I just let me just say this: V12, vitamin B12 should be measured in patients with what sort of anemia? That's autoimmune, pernicious anemia, right? And a patient with pernicious anemia will have what sort of red blood cell findings? Right, severe megaloblastic for the most part. And what electrolyte should they have checked periodically? Potassium levels, right? They should have their potassium levels checked periodically.